Welcome everybody. With you Dr. Magdi Abdelrazik, consultant of infectious disease, hepatology, and gastroenterology. Our topic today about ulcerative colitis. We will discuss the causes, symptoms, signs, complications, and treatment of ulcerative colitis. It is a long-term condition that results in inflammation and ulcers of the colon and rectum. The primary symptoms of active disease are abdominal pain with diarrhea mixed with blood, sometimes weight loss, fever, and anemia. Often symptoms come on slowly and they can range from mild to severe condition. Symptoms typically occur intermittently with periods of no symptoms between flares. Complications may include abdominal dilatation of the colon and disease called megacolon, inflammation of the eye, joints, or liver, and also sometimes lead to colon cancer. The cause of ulcerative colitis is unknown, but some theories say may immune system dysfunction or genetics or changes in the normal gut flora or environmental factors. But until now, there is no specific cause of ulcerative colitis. Diagnosis typically by colonoscopy with tissue biopsy. It is a kind of inflammatory bowel disease along with Crohn's disease and microscopic colitis. Dietary changes such as maintaining high calories diet or lactose-free diet may improve symptoms. Several medications are used to treat symptoms and bring about remission, including aminosalicylates such as mesalazine or sulfasalazine. Sometimes we use steroids, immunosuppressants like azathioprine. Also, sometimes we use biological therapy. As regard the surgical solution, usually we resort to it in rare condition. Sometimes removal of the colon by surgery may be necessary if the disease is severe and does not respond to treatment, or if complications such as colon cancer develop. Removal of the colon and rectum generally cures the condition. Together with Crohn's disease, they may affect many people in the world. So, as regards ulcerative colitis, the main symptoms is diarrhea mixed with blood of gradual onset that persists for an extended period of time, sometimes weeks. Additional symptoms may include fecal incontinence, increased frequency of bowel movements, mucus discharge, and nocturnal defecations. With proctitis, inflammation of the rectum, people with ulcerative colitis may experience urgency or rectal tenesmus, which is the urgent desire to evacuate the bowels, but with passage of a little stool. The clinical presentation of ulcerative colitis depends on the extent of the disease process. As regards ulcerative colitis, if it is severe, may lead to systemic disease, systemic manifestation and increase in erythrocytic sedimentation rate, and also increase in CRP, the C-reactive protein, and also may lead to fever, may reach to 39 degrees centigrade, or anemia, and also toxicity sometimes present, as demonstrated by fever, tachycardia, anemia, or elevated sedimentation rate or C-reactive protein. Fulminant disease correlate with more than 10 bowel movements per day, or continuous bleeding, or toxicity, abdominal tenderness, and distension. Blood transfusion may required, and colonic dilatation or expansion. So, people with fulminant ulcerative colitis may have inflammation extending beyond just the mucosal layer, causing impaired colonic motility and leading to toxic megacolon. Ulcerative colitis may improve and enter remission. Remission of the disease is characterized by formed stools. So, what about the extra intestinal manifestation? Sometimes colonic cancer, sometimes may affect eye and lead to iritis or uveitis, sometimes associated with primary sclerosing cholangitis, sometimes associated with ankylosing spondylitis, sometimes associated with pyoderma gangrenosum, sometimes associated with erythema nodosum. So, as regards this disease, some manifestation in gastrointestinal tract, and also other manifestation, systemic manifestation in general. The two most common oral manifestations are aphthous stomatitis and angular cheilitis. So, as regards this disease, sometimes we cannot diagnose this disease except after making colonoscopy. As regards colonoscopy, sometimes make sigmoidoscopy, or sometimes take tissue specimen from the colon. As regards ulcerative colitis, there is some environmental factors affect on the disease. Maybe the cause diet or environmental condition. But as I told you before, we don't know the exact cause of this disease. As regards the treatment, we sometimes we give steroids, sometimes we give aminosalicylate, and as regards this disease, it is a long-standing disease. Thank you very much.